And so it's finally come. The test of PNG's health mettle. COVID-19 cases have been on a dramatic rise since the start of July. The big questions, how and why? The first case detected in Morobe, widely publicized and causing near chaos. The second case, leading to death threats and such wide stigma that the woman in East New Britain province at one stage going into hiding for fear of her life. Other cases coming from the border province, one from the Eastern Highlands and 3 from the Western province were added to the tally. There was a disparity with no known links between cases. It left authorities perplexed. PNG's early cases popping up so randomly and seemingly unrelated. Yet for all that, it's the nation's capital under scrutiny at the moment. A surge in cases in recent weeks, all tied to the Central Public Health Laboratory that is increasingly coming under the glaring spotlight. The positive cases that were reported there not only included the workers, but their family members as well, which has led to schools also being closed. And the reports regarding community transmission have been intermittent, with testing ongoing, and to date, according to the Prime Minister, over 10,000 tests have so far been carried out. PNG IMR, the Institute of Medical Research in Goroka Eastern Highlands Province, was initially tasked with sampling and testing. That process also moved to put more speed to increase testing capabilities, both institutes able to test 200 PCR samples a day.
So you will expect that this sort of thing will continue to be with us, and it will happen. And maybe that's what's happened here. So that's why we have to take on the vigilant, serious approach to mitigate.
Testing is happening as we speak as well within our laboratories?
Testing is happening, yes. And although we have had this issue in the breach within the lab settings, we've gone on to decontaminate the laboratories and get them right on track. And then we'll get back again to where we were. But as we have done that in terms of dealing with this particular lab, there's other labs where we are getting the testings to continue on. And that's happening right now as we speak.
It's shown the desperate struggle that PNG's health sector has been facing. And now, only days ago, the staff at PNG's largest health service facility, the Port Moresby General Hospital, protested.
How best are you going to look after the nurses, so-called the frontliners?
Understandably so, yet scary. If the hospital is closed, where then can the sick go? And even more concerning is that it's health workers contracting the coronavirus. Those who are serving the nation are now themselves very much at risk.
We have set our process in place with collaboration with WHO to assess the risks of the staff that has been exposed. If you are at risk, we isolate them. So we've got isolation facilities. We've got a place outside of Port Moresby General Hospital, as well as here, where we can isolate our staff and monitor them.
An important part of the health sector, the St. John's Ambulance Service, has been overwhelmed with emergency calls.
We understand that there is money for COVID that is being circulated to other agencies. For us, it's just about maintaining core business. We haven't received the funding this year that we need from NDOH to operate the ambulance service for the government. We've only received a fraction of it, and we've been working closely with the department to get that released. Just like every other health service, just like the church health services, we're all in this together, and we all count on the support from the government so that we can serve people. Because
the battle on the front line, the skirmishes online, information being propped up on Facebook, Twitter and YouTube showing differing data, and authorities have had a hard time trying to deal with the oh so many conspiracy theories. At one stage, the 5G network being blamed for the spread. Bear in mind, there is now a law in place for dealing with those that purposely spread misinformation. But for all the consternation, what has been alarming is the normality being displayed, almost as if PNG has accepted its fate. Through observation alone in these trying times has been the responsiveness of NCD's citizens. Traditionally domiciled, the rise in cases has done little to curb the activities of the nation's capital. Businesses are still running. Markets were very much open, as crowded as ever until just yesterday. Although retail businesses and corporate organizations have taken it up upon themselves to be socially responsible. When the first cases were announced, the buai ban came into effect, a massive nationwide crackdown on PNG's favorite nut. Borders manned with a zeal that surpassed land and monitored the seas. And for all that effort, it's also now back into business. This, even after over 90 cases to date, and sadly, people have died.
I have the certificate of one of them here, which clearly certified that it was a COVID-19 death that had happened. The second case, we are waiting for the confirmation of the medical certificate, but it looks like the second case was one that was with comorbidities, meaning that there's other problems with him in terms of his medical issues with COVID-19, and that would have been what would have complicated him and was the result of his death as well.
Lifestyle standard that is required of us in Port Moresby City, and the controller will basically put them out. Today they had a very long meeting with the members of our medical community, the scientific team we have attached to the National Control Center. And so those protocols established will be detailed by the controller, and the controller will issue them. Just on a headline basis, few of the measures would be wearing masks at public places at all times, for instance, as I said yesterday.
Are we hoping to make wearing this mandatory as well?
Yeah, public place wearing a mask will be mandatory. We will be deploying full team of military, police, medical workers in different zones in the city, and isolation strategy will be announced.
The current administration of Papua New Guinea has pumped millions over the past few months into the COVID-19 fight. They've admitted that it's a tough task. But then the current government, and even the previous one, are inheriting a problem that should have been solved decades ago. At present, the Rita Flynn complex, and now an isolation facility, for all the money spent, is vastly inadequate should our cases skyrocket into the hundreds. Commissioner David Manning has issued new measures that detail a proactive approach at containment. What is needed is a responsible citizenship, one that uses logic and reasoning to the issue at hand.
Whilst there are doubters and skeptics out there, criticizing the NCC and the government's efforts at every step of the way, and as far as the steps that we're taking, let me reassure you all that our pandemic response efforts are the best possible practices that we've sought our best legal and medical advice on, in terms of how best we can also respond to the COVID-19 pandemic in the country.
So far, it's only Port Moresby that's been massively affected. The rest of the country is still very much open. Lay City this week recorded a case, but no other reports have come regarding the status of the rest of the nation. The rest of the world imposed strict restrictions. It's far more relaxed than the country compared. Our foreign diplomacy machine has also been hard at work. With China's growing influence across the region, it came as no surprise when in mid-June a donation of PPEs and ventilators worth roughly 1 million kina came in.
Prime Minister wrote a letter to President Xi Jinping, and the Prime Minister also hosted a luncheon, a charity luncheon, raised money for the Chinese people. So when PNG, when the virus spreading in PNG, and China reciprocate the kindness and the support given by your country.
The United States responding as well.
Today, I am proud to announce that the U.S. government is providing a total of 40 ventilators to the government of Papua New Guinea in order to further boost the country's capacity to respond to the negative impacts of this pandemic. We've learned in recent days it's not enough now to prevent. Now we must respond, and I hope that with the gift of these ventilators, Papua New Guinea will be in a better position to care for those who may be affected and impacted by this terrible, terrible disease.
And it hasn't gone unnoticed that while both nations are doing this out of humanitarian goodwill, that the world's superpowers are also asserting themselves in these trying times. And assertiveness is very much needed, especially domestically. Officials from both the World Health Organization here in PNG, as well as the National Department of Health and other agencies, have been issuing warnings non-stop, not just because of the threat of COVID-19, but also for basic hygienic practices. Public sentiment that the government hasn't done enough is one thing, but the onus should be placed on each and every single individual to decide for themselves what the right and, more importantly, safe course of action is.